Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Today, I'd like to talk about the rationing mindset, something we've had to adopt and adapt to. Now, some of us in America and here in Western North Carolina know all too well what it's like not to have access to what they need. Now, with coronavirus, the rest of us are coming to grips with that reality. We've seen it in many ways. Here are a couple. First is testing. In an ideal world, we would be testing everyone, quarantining and isolating those infected, and everyone else carrying on with their lives, albeit with precautions to prevent spread. But we've not had that capacity to do this sort of testing, so the only alternative has been a strict shutdown. Second are masks. We've had to reserve medical-grade masks for those at the front line at highest risk, so not everyone can have the most secure mask. Third, we've had to ration ourselves, withholding physical contact and limiting individual contact to our households, limiting emotional connections. We've all watched as people struggle through hospitalizations, and we've watched others grieve alone as they watch dear ones die alone. And a really big one, choosing who doesn't get a ventilator when they need it. And fortunately, here in Western North Carolina, we've not had to face that yet, which is why we should all be taking the recommendations to heart so we never get there. And so if you get sick or hurt, for whatever reason, the healthcare system can be there for you. But in the midst of this rationing, we've also seen so many ways that people have adapted, new ways to connect emotionally, and a shared purpose on which to act. Now, we've had to adopt this rationing mindset in a really short time, and that's a really hard thing to do. You know, if you've ever been frustrated that people just don't change, well, here's a case study that says otherwise. So keep your focus on what you can do today and what you need to do today. Be well, stay emotionally connected, and physically distant.